Stop getting called to chart audits. Here are a dozen things that's going to help fix your nurse's note. So, if you've ever struggled or felt nervous about your nurse's note, here's 15 things to consider. Number one, the purpose of your nurse's note is not only to write what's going on with your patient, but remember to legal document. So, number one, we're documenting to give an account for the subjective and the objective data that we collect on our patient. Number two, we are recording all the planning and implementations of the interventions that we do for our patients and the care that we deliver. We're also monitoring their responses to these said interventions. We're facilitating interdisciplinary communication. It's also used to substantiate utilization reviews, right? So if we see that, you know, there's active use of a Hoyer lift, that may require the unit to get more Hoyer lifts based on the acuity of the patients, right? Also, it's going to provide information about billing and services. So we have to be accurate when we're documenting the things that we do for our patients. There's actually different things that nurses have gotten in trouble with in the past when they were billing for services that they didn't actually do for the patients, right? But that's another video. Other than that, we're also showing that we're delivering quality care to our patients. That's one of the key things that's going to be looked at whenever we're looking at our patient's chart ever for any kind of deposition or anything with the Board of Nursing. They're going to look to see that you're demonstrating the quality of the care provided based on your scope of practice. Also, it's looking to see if we're complying with the professional responsibility of providing nursing care, right? We talked a little bit about this just now about our scope of practice, but it's our professional responsibility and a duty due to the patient for us to take care of them in a certain way. And that's what we're showing when we document. Also, we're documenting the client's report. So, whatever they said, whatever they reported, we're going to put those in quotation marks and put that in the chart. Also, we're documenting what we observed as a nurse. Remember, we use the word observed, particularly when it comes to our assessments, or if there's a patient that has fallen, we're going to use words such as observed, right? That's going to be more favorable to you in the charting whenever you're documenting this. Also, it's used to show the care plans that are being instituted and being used to provide the ongoing care for this patient, the interventions, procedures that were undertaken, and lastly, the patient's response. So, this is what is encompassing of our chart in just a few kind of like bullet point metrics. Again, it's so much more than what we think. And I want to encourage new to practice nurses to be aware of this and to know that you have to document in a way that you're showing the safety of the patient and you're prioritizing all the things that I just said.